we made significant strides in creating the opportunity to add direct primary care to health plans. I don't think we're quite there yet in West Michigan, but what you're doing from a concierge standpoint, especially with your integration with Nomi Health that's entered the market here, can you speak to what that program looks like and why it would be different than what was otherwise available just through a traditional health plan?
Yeah, absolutely. And I think, that's the absolute catalyst that kind of moved us in this direction. I started for my first 20 plus years in primary care, and we were self-employed, but it was an absolute grind trying to see that many patients, care for that many folks, and to do it effectively, yet provide enough income to where you could kind of facilitate what you needed to do from even just a family standpoint. But so I moved out, started the concierge medicine practice, which is a standard fee. Right now we don't have any co-pays or fees at the office. It's a yearly membership fee, if you will. But the primary initiative was that we were going to be a much better partner in that healthcare journey with the folks that we're fortunate enough to serve. And so we did a lot of preventive medicine, which is truly the way that I think it has to go in the future, because right now we're putting out fires, and by the time people show up, they have a symptom, the cat's out of the bag, there's not an early identifier, there's not a cost-effective mechanism, there's not the chronic disease management that's really present. So I could even just say in like the last 12 months, we found, just from our screening tests, we found 7 cancers, 3 pancreatic, 3 kidney, and a liver cancer, all super early stage, and all 3 pancreatic cancers were cures surgically with partial pancreatectomies, which never happens. So right there we found numerous cardiovascular disease that was kind of lurking in the background. We're able to address these. I can tell you in 8.5 years, I've not had one person have a heart attack. Not one person have cardiac failure. It's the ability to kind of do this. So what we wanted to do is we wanted to see how can we distill this down to the masses and provide that same or very similar level of care and prevention to everyone in the community. So we fortunately came across Nomi Health, and Nomi is a national organization, and what they do is they sort of cut out the third parties. So they will eliminate the Priorities and the Blues and the United Healths, and they will simply pass dollars through. Now that employer still needs a catastrophic reinsurance policy for extended hospital stays, catastrophic illnesses. But our responsibility then has been to build the network. And fortunately, in my original practice, I had a little over 250 of my patients were physicians. So I got to know them very well, and we built a trust and relationship. But we've now been able to pull in independent imaging centers like John and Matt with the imaging center, independent surgical centers, the Right Care Clinic for more urgent and emergent care, all of our colleagues on the specialty side who are independently practicing these days. And so what we can now do is we can offer to some of those employers, and we're fortunate enough in our practice to have ample amounts of folks that either own or are responsible for business-based decisions. And we are partnering with some of the nursing groups who can go on site to provide care. We're going to partner with, whether that's a purchase or walk lockstep with direct primary care. And those kind of opportunities allow those individuals delivering the care to have a reduced patient population in that 600 patients. So they have time, they have the education, and if we have the time, the patients will tell you what's wrong every single time if you just take the time to listen and ask the questions. So it doesn't, we can have early detection, cost mitigation. So even just for instance, we have a large manufacturer in the Hudsonville area. They have about 2,000 employees. Nomi also has their own pharmacy benefit manager, which works direct to the manufacturer. So kind of like, Mark Cuban and Amazon do. But in any event, it's about $15,000 a year for an employee and their family in healthcare costs to the employer, today.
On average, unless you're Tim Ellis.
Right. And so this organization will save about 41% of that cost by leveraging Nomi and the network that we've built. But that network with Nomi, obviously the simple benefits folks are involved in that to assist on the navigation side. So it's really a nice uniform option of leveraging community benefits, eliminating the hospital costs unless somebody actually does need to be inpatient, and just being a better partner, not only on the financial stewardship side, but on the healthcare journey with those folks. So we've really taken our model and distilled it down. When they join Nomi, the executives join our practice. Our nursing and direct primary care initiatives will take care of the employees, and we'll go that way.
So that you can roll up and provide that same level of service to not just executives, but the entire staff at the organization. It's great.